All right, so this is a short presentation where I'm going to go over some test-taking strategies. Basically, how do you break down the EMS and medical style multiple choice questions in a strategic way that will help you more often find the correct answer and find it more efficiently than you would by just reading the question from top to bottom. So first, let's review what I like to call the anatomy of a question, the different parts of a typical multiple choice question. So in EMS and many medical specialties, the type of questions you see on exams typically are presented as a couple sentences or maybe even a full paragraph. And so let's break down the different parts of the first part of the question. So we'll notice in this multiple choice question, the actual question itself doesn't come until the very end of that small paragraph. What is the most appropriate next step? So that's the actual question within the question stem, and the question stem is this paragraph here. Okay, and in EMS, usually the rest of the question stem is a scenario of some sort, giving you a little bit more information so that you can pick the most appropriate choice. And then the rest of the question has to do with the answer choices down here. So as I said before, the question stem often contains some sort of patient care scenario. Sometimes the question stem could be as simple as one short sentence that's asking you a simple question, or sometimes it's an entire paragraph. Now let's break down the actual question itself, that end of the question stem. I find that they're typically either one of two general types of questions. Either it's trying to get you to answer what type of next step would occur in a patient care sequence, or what is the next type of procedure you would do. That's when going back and knowing your NREMT skill sheets comes in handy, because that's essentially what they're asking, is for you to know the next step in the skill. And the other general type of question I call a knowledge question. Basically, it's just having you recall some sort of knowledge that's not part of a sequence. So maybe it's some sort of information about anatomical part of the body, or perhaps they're asking you to diagnose something or the most likely condition, stuff like that. So these questions tend to be more challenging because they require multiple levels of comprehension. You'll see in a few minutes as I go through some examples, oftentimes when the question is a procedure question, it's going to have you need to evaluate the patient scenario, basically come up with the most likely diagnosis of the condition. Then you're going to have to know what type of intervention you would do next because of that diagnosis, and then because you know the intervention, you'd be able to know the next step. So we're getting down 2-3 levels of mastery of information. That's why it's important that we have a strategy when we approach these questions. Something I like to do that helps me is to take pertinent notes of the scenario. You'll see that as we go through some examples. And with each scenario presented with in the question stem, it's a good idea to make a list of differential diagnoses, basically what are the most likely conditions this patient could be suffering from, and also make a list of the likely interventions. So let's move into the key steps for evaluating these questions. Number one, don't look at the answer choices yet. You can cover up the screen or the page with your hands, or just use a blank sheet of paper. That helps, and you can sometimes just leave it resting against the monitor. I don't want you to get distracted by some answer choices and lead you to think in a certain way that could actually lead you to choose the wrong answer. So you're not going to look at the answer choices until the very end of the evaluation process. The next step is to skip to the end of the question stem. So you've already ignored all the choices, and now we skip past the first part of the question stem, where normally the scenario is there, and we go to the very end where there's actually a question. And we think to ourselves after reading it, what is it asking you? Is it a next step, an assessment sequence, or are they asking for some sort of piece of knowledge or diagnosis? So start to think about that. Now that we know what the question is actually asking for, we'll go back and read the rest of the question stem. So usually scenario, this is where I like to take brief but pertinent notes and sort of paint a mental picture of what the patient's looking like, what's going on with them, and what's likely wrong with them. And then I start to think of what type of interventions I would do next. And especially as you're reading the scenario, you should look out for any red flags, which are key signs and symptoms of particular illness or traumatic condition. The fourth step, after I've covered up the answer choices, read the end of the question stem, and then read the rest of the question, is to think of possible answers before I look at the answer choices. Some people find that writing them down helps so that they don't talk themselves out of what they thought the answer was. And you could also include a few possibilities of varying levels of detail, as you'll see in some of the examples. Now, finally, I'm going to reveal the answer choices and scan through them to choose the best fit with what I thought the answer would be. So sometimes when you've thought of the answer choice ahead of time, you'll actually find an answer choice that matches exactly what you thought of. And that makes it very easy. You just choose that one and you move on. That's most likely the correct answer. Some other times the answer choices have different levels of detail, or maybe we really didn't know what the question, the answer would be. So when this method fails, then you just use the process of elimination. Let's start with the first example. So I've covered up the answer choices just like you should do when you're taking an exam. And that was the first choice, or first step. And now the next step is I'm going to skip to the end of the question stem and read the actual question. So what's the actual question? It is, what is the best course of action? So this is the type of question where they're basically saying, what's the next step? What would you do based on the scenario? So it is a next step type of question. All right, let's read the rest of the scenario. So you arrive on the scene of a shooting at a bar. Right away, that tells me that this is most likely a trauma situation instead of a medical. So that rules out a whole host of medical problems. The police call you in, stated the scene has been secured and that there are multiple shooting victims. So, multiple victims is what I would think about next. Multiple patients. The first victim you see is lying on the floor with a spurting wound coming from the brachial artery on one arm. So we have severe bleeding. All right, and they're still holding a gun in the other arm. All right, now let's think again. What is the best next step? Well, in my thought process, it looks like I've just arrived on the scene, so I haven't done any other assessment steps. Now, what do you do in the scene size up? Well, we make sure we have BSI on, call for additional help, but one of the first things is to check for scene safety. So if I came across a patient who had a gun in their hands, would I try to take the gun away from them? Would I retreat, call police? Well, since we're not trained to disarm people from weapons, I think probably what they're looking for is that we would need to either get police involved somehow or retreat and then call police. So my answer is going to be something that involves retreating, scene safety, and possibly also involving the police. I'm not quite sure which level of detail they need, but they're all kind of along the same. So let's now look at the answer choices. Next step. All right, so remember my answer was going to involve scene safety, retreating, calling police, and now I scanned through the answer choices. All right, A, immediately control the weapon. Definitely not. Ask the patient to drop his weapon. Probably not, because it's not going to be safe if they don't comply. Apply strong pressure to the bleeding arm. Well, yeah, you would do this, but in the primary assessment, we're still in scene survey. And D, retreat and notify police there's an injured person with a weapon. I think D's the best answer here, because it's addressing the scene safety aspect of it. You need to get police involved, and you need to get out of there because your safety is at risk. Here's the next example, and I use this one because it's an example of a question where it's very, very brief. So all it reads is all of the following are PPE except. So this is a type of knowledge question. They're not asking for the next step or anything like that. All right, let's break down this question. So the way I would answer this is I would think, well, what is PPE? PPE, if you haven't learned it already, stands for personal protective equipment. So personal protective equipment is stuff we would wear to prevent bodily fluids from getting on us, hazardous materials, infectious agents. So some examples I would think at the top of my head are just gloves, mask, gown, goggles, or eye protection. Those are the main ones you would use in a call. So now that I have that in mind, I'm going to be looking for an answer choice that isn't one of these. All right, and my choices are gowns, gloves, hand washing, and HEPA mask. All right, well, gowns, gloves, and a mask are all examples of PPE, so then hand washing is the correct answer here. It is not a form of PPE. Next question. Remember, let's skip to the end of the question stem. So we're going for this last part. It's a bit of a long sentence, but it says, based on your understanding of the cardiovascular system, you know he could be suffering from damage, narrowing, or blockage of what arteries. So we're going to try to identify which arteries are having problems in this scenario. So it's a type of knowledge question. They're not asking us for the next step or best course of action. They're asking us for a piece of knowledge. You're caring for a 48-year-old male patient, or sorry, 47. So 47-year-old male with classical chest pain suggested of an MI. All right, so now I think we have all the information we need to answer this question. The chest pain and myocardial infarction narrows it down to the heart, or at least the chest. Now, somebody who might be having a myocardial infarction, we already know what type of arteries get blocked during this, the pathophysiology of this condition. Well, it's the coronary arteries. So we'll keep that in mind and now look at the answer choices. All right, so scanning through, we see it right there. Exactly what we thought of. Coronary arteries is the correct choice. If you ever have an issue where you tend to choose an answer choice, come back to it, and are debating if you should change it or not, you should just leave it. Research has shown that your gut choice, what you think is correct the first time around, is more often likely to be correct than if you change it to something later on. All right, so with this in mind, keep practicing. Utilize this method on all of your quizzes and exams, and make sure if you need any extra help with your exams after you've taken them, you want to go through them, just let us know. And to recap, what are the steps of taking a multiple choice exam? Well, number one, you're going to cover up the answers. Number two, you're going to skip to the end of the question stem and figure out what type of question it is. Then with that information in mind, we're going to read the rest of the scenario, take pertinent notes, and try to figure out what's going on with the patient. After I've read the scenario and broken down the patient situation, and I've come to what might be the likely diagnosis and interventions, if that's the type of question, then I'm going to try to think of the correct answer or possible correct answers. And then finally, I'm going to look at the answer choices and pick the most appropriate answer.